Cystic fibrosis is an inherited and complex disease that can bring many challenges to those who live with it. But dealing with this chronic disease can be especially difficult to children and parents alike. That's the case for 11-year-old Kailee Phan. She's a high-spirited little girl who battles cystic fibrosis, or CF, daily, including having a smaller than average stature for a child her age. But thanks to the pediatric specialists at community medical centers, Kailee is receiving the best care to help her continue living a thriving childhood.
Are you a young lady?
Yeah. It's been more than 8 years since Kailee Phan first met pediatric pulmonologist Dr. John Mua. She was referred to see him after her pediatrician noticed she wasn't growing as expected for a child her age. She underwent a sweat test to measure the amount of chloride in her sweat. She tested positive and was diagnosed with cystic fibrosis. But Dr. Mua said Kailee's case was unique because she didn't fit the bill of what a typical CF patient looks like. She also didn't have the genetic makeup.
Even on her genetic study, she does not have the normal genetics. She's got the poly-Ts and the TGs and no definitive disease-causing mutations. Yet, she's got the positive sweat tests.
Kailee's father says when they received the CF diagnosis, their family was crushed. Kailee was only 2.5 years old, and to this day, it's still difficult.
Her breathing, every day she struggles, with everything. Can't play sports like every other kid or be active like every other kid, and it hurts.
She's also dealing with a lot of GI issues as well too. She's got a G-tube.
Kailee is 11 years old, but her height and weight are more like a 7-year-old. Dr. Renee Kinman is the medical director of pediatric endocrinology at University Pediatric Specialists. Kailee was referred to see her to get a handle on her stunted growth.
Kids with CF tend to be shorter, and they tend to have delayed puberty. So,
and why is that?
The reason they tend to be shorter is, if you think about it, first of all, they can't absorb food as well. And then second of all, they tend to use more calories breathing, and so you have less calories left to grow.
Human growth hormone is one of the treatments Kailee receives to help her grow. And while treatments have been successful for Kailee, Dr. Kinman says growth hormone injections can be complicated.
The risk of growth hormone is that we don't know what can happen 50 years from now, so you have to have that conversation with the parents.
Kailee receives one growth hormone injection every day, another obstacle she faces in her daily fight against CF.
She's the strongest person I know. Every day, like I said, she's a fighter.
She obviously has done tremendously well, and ever since starting the growth hormone, her weight has gone from kind of this slow plateau to a sharp angle that's kind of going upward.
Dr. Mua says Kailee's prognosis with her growth and CF are positive, and that's due in part to the multidisciplinary care she's received from the pediatric specialists at Community who collaborate daily, especially with complex cases like Kailee's.
That's kind of the key to what we have here, and that's the beauty of what we do, is that I can call Dr. Kim and say, hey, Dr. Kim, can you come and see this kid? Because I think there's something else going on out there, and she'll actually run across and just come and look at and see the patient with me.
Sok says he's grateful Kailee is cared for by physicians and a team who are compassionate about ensuring his daughter lives her best life.
Thanks for being part of our family. It's heartwarming.